Thermage is basically a non-surgical method of tightening your skin.
It's technology that works on the collagen deep in the skin without damaging the layer that everyone sees.
And how it works is basically they use radio frequency waves that are transmitted from the probe into the skin, and it goes through the top layers and then the bottom layers of your skin. But the top layers, at the same time as the radio waves are going through, the top layers are cooled and only the bottom layers are heated.
The physician's assistant uses a stencil applied to the patient's face as a road map. The probe sends energy through the skin. That heat causes gradual changes in the collagen, and as it begins to reset, patients are supposed to notice their skin getting tighter over a 2 to 6 month period, though some patients say they see improvements immediately.
There we go.
54-year-old Holly Joyce doesn't want a dramatic change in her appearance. She just wants a lift without the risks, recovery time, or cost of a facelift.
I'm a person who's into more natural approaches to life, so I thought, well, this might be pretty effective and exciting.
Holly also likes the fact that experts say Thermage has few risks associated with it.
The risks that we've seen are some minor blistering. The big risk, I think, with Thermage is the procedure itself is a little uncomfortable.
That's where some shrink wrap, some special cream, and about the time it takes to watch a newscast come in.
This is a topical anesthetic. It numbs the top of the skin and takes away some of the discomfort that she might feel.
The cream takes about half an hour to work. The shrink wrap prevents it from drying out.
Right here.
In about an hour, this patient will be a graduate of Thermage technology and should be on her way to a younger, refreshed look.
Well, I hope it just works on some of these little wrinkles around mostly around my mouth.
Thermage is supposed to tighten the skin, but the results shouldn't be confused with what is expected from a facelift.
With the facelift, you're actually trying to remove redundant or extra skin. With the Thermage, you're actually trying to preserve the skin, but tighten the remaining skin.
Okay, here we go. You might have to adjust yourself a little bit.
Well, I've heard that there's a slight amount of pain, but I don't know what that really means.
Holly Joyce is 54 years young. She isn't expecting to look 25 again, but is hoping for a refreshed look with fewer wrinkles. Thermage promises to do that by heating the collagen in her skin without damaging the outer layer.
It heats the under layers of your skin while simultaneously cooling the top layers of your skin. And so you get the benefits of the tightening of the collagen without the disadvantages of redness, changes in pigmentation, and all the weepy, gooey mess that you got with lasers.
All right, thank you. I should have said.
Physician's assistant Jessica Cochran is armed with shrink wrap and numbing cream. Together, they'll work to make the process less uncomfortable for Holly.
It might tingle a little bit.
It looks pretty odd, and it feels strange, too.
It's my skin, but it feels like it's separated from me or something like that.
After about 30 minutes, it's off with the shrink wrap, then a thorough cleansing with alcohol to get the patient's face squeaky clean. A stencil is then applied. It will act as a road map of sorts to guide the procedure along. A bit of fine-tuning to get the level of intensity adjusted, and it's time to begin.
It doesn't really feel like heat. It feels like a pinprick.
We're getting towards a more sensitive area in here.
Yeah, I can feel that.
Yeah.
But it's not unbearable.
Holly will have 450 passes of the probe across her face before the procedure is complete. That will take about an hour. We wanted to see if there was a noticeable difference halfway through the procedure.
I can already see that this fold is starting to flatten a little bit here as opposed to that side. See, this has still got its crease. And in through here, this is less droopy right in through there and there. And I'm going to have you look down a little bit. See, I think you can see it a little bit more from above, how this side is starting to, yeah. So it's kind of
Holly
neat.
will be able to see the early results for herself soon, and with that incentive, it's back to work on the other side of her face.
We're done.
Can still smile.
As the patient's face is getting cleaned off, here's a simple illustration of how Thermage works over a 2 to 6 month period. It's similar to making Jell-O. The collagen is heated, it reacts to the heat, then just like it takes the Jell-O time to firm up in the fridge, it takes the collagen time to reset itself.
Goodness gracious alive. Oh, I do. And in here.
Holly, where do you notice the most difference?
I would say around the mouth. Wouldn't you? Definitely around the mouth. Wow.